Here's mother washing dishes. Here's the little girl. I'm not positive what she's doing. This is so old. There's dad, in my opinion, behind bars in the front door, not being allowed in. I mean, it's just, that's why I keep doing this, because it's fun and it's interesting, and you get a lot of information. The other thing I use for the psychological part is something called the Rotter Incomplete Sentence Test. They're what they call stimulus parts. At bedtime, I regret, my greatest fear, I can't. School is okay except for my mother and father always. What makes me maddest is, and I ask them just to fill it out. If they're having trouble writing, I'm having trouble holding on to things. If they're having trouble writing, I say, I'll be your secretary. And I just dictate the little beginning of the sentence and they fill them out. Again, would I judge from one little comment they make? But if they say 14 times they hate school, homework is terrible, this, that, and the other thing, am I going to make something out of that? Yes. So I look for themes, and then I tie it in with the other things that I do. So, the IQ test, I forgot to mention one thing on that. I'm sort of going at some things backwards here, but that's all right. We'll get through it all. So basically, for the only other test I use, yes, for psychological, this is also part of the processing test. This is called the Bender Gestalt. Very fancy name for a test where you pass out 9 cards, and don't go around telling everybody these secrets, please, because then if I give them the test, the secrets will be out. I pass them out 9 cards, and I say, copy these designs for me. And can I do them on a separate sheet of paper? You may do it every way you want. Can I line them up along the edge? You may do it any way you want. The variety of answers that I get on this little test. When I studied this, I was older when I went back to school. And so I was a little cynical about some of the things. And I was very cynical about this test. Now I go to court on this test. Not with it alone. I take some other information. But it is kind of fascinating. First of all, this is a little boy who is 6 years old. His drawings are indicative of a child who has perceptual problems. He doesn't connect things here. It looks like it's hard for him to draw. And that is proved by his writing sample, which is right here. He is 10 years old, and that's about a writing sample of about a 7-year-old. So the tests back up. If I have only one test that I'm going on, I don't feel comfortable with that. I'm either going to do at least 2 to see if the answers are there. What I get, the results are the same. This test, called the Bender Gestalt, can be scored by something called the Cockpit Score, which gives you visual motor integration, which backs up another test I'm going to talk about in a minute. And you score the designs, and then they get a score, an H score. It also has emotional indicators. A child who puts all their designs on one side like this, it's kind of like they're hanging on to something. They need security. Or if they put a mark around each design, that also is supposed to mean they're insecure. If a child puts the designs on different sheets of paper, I would say sometimes there's going to be some acting out with that little boy. Because most children plan it carefully and put it all on one page. That would be the normal thing to do. If I have a high school student who puts his design on each page, I call the parents that day and say, watch out, this child is going to be in trouble, drugs, alcohol, or some kind of thing. And I'm not kidding. And you may laugh at that all you want. I did for a long time, but it is amazing. If you choose to put a design on each page, it's supposed to mean that you are on the way to exploding or going to act out. This particular little test was given to a young man who I've been seeing now for a couple of weeks. I've seen him 3 times, maybe twice. And he is a 10-year-old and 11-year-old. I think he's too good. Does that sound crazy to you? He's just too perfect, and it makes me very nervous. And so I gave him this little test. I said to the parents, do you mind if I do a little extraneous testing as long as he's here? And he put every design. I think he's a volcano ready to explode. He put each design on a separate sheet of paper. And I think that he needs some guidance in how to show his anger and how to do some things. These are some things that teachers should be able to look at and know when they get essays written or they see different drawings, that there's something going to happen. Every time I read in the paper about these awful things that have happened, I think, where was everybody? Why didn't someone look at that and notice that something odd was going on? It does go into class size, which I could lecture on for about a half an hour, and how important it is to have just a few teachers in the classroom. Question.
What do you do if you see that, as a parent or a teacher, that the child has produced separate things on different pieces of paper? How do you
get them help?
What sort of help?
You see a psychologist.
Okay. So they haven't done anything, but
they haven't done something. But with this, I certainly have said to the parents, I'm concerned, and only after 3 times. And if I were them, I would talk to the school about it. The trouble with schools is that schools differ from night and day. One of the issues I have, I get going on skipping around different things. I will get to that in a minute. About parents not wanting to have their children, the parents, know anything about the testing I've done because they don't like some of the answers, so they don't want me to send their report to the schools. Let me finish with what the whole business of testing is. I missed one test that I did want to show you, and then I'll talk to you about some of those other little negative things I was going to mention. This is another test that I haven't seen many people down here use. It's called the Berry-Buchanan Test of Visual Motor Integration. Here is a boy who is 10 years old. You can look at his scores and his drawings. He's a budding architect. I think he's going to do some kind of design work or something sometime. The designs are perfect. Now here's one of these cases where I'm talking about a 6-year-old, 5-year-old boy. Immediately, if you look at this, his designs and scores are not bad. He's 6'5", he's scoring 6'7". These are years and months. 6 years, 7 months. 6 years, 2 months, or 6 years, 0. Look at the G in his name. It's backwards. And we used to say half a kindergarten class are going to reverse their letters because the little neurons up here aren't ready to do them forwards. And here's a perfect example of that. This is a boy who's 9 years old, 2 months, and he scores at about 7 years old. And you can begin to see where his designs, he has trouble doing them. When there are little hooks on the squares, that's a sign that there's some visual perceptual neurological issue going on. If they draw the designs counterclockwise, that's also. Some children work from left to right. How is their reading? How hard is it going to be for them to learn? They have to go the other way. This one is a perfect example to me of how you can tell developmental issues. This little boy is 4 years, 4 months. And I'm going to pass this around. You can see where I put a little X that he has not gotten the square right. But he is interpreting this particular X as that. And that's what he really sees. So how are we asking him to do letters and numbers and reading at his age? Anyway, I'll pass that around. Now, I think I have covered all the things. How am I doing time-wise? I don't want to keep you all working.
Give about 12 minutes. Yeah, 10, 12 minutes.
Okay. I do want to clear up some things that I think are still confusing to other people, and that is IQs. I read about IQs in the paper and I think, what tests have they given? I have tested, as I said, for 100 years, not quite, long time. The highest IQ I have ever gotten is 140, 3 times.